Good morning, everyone. I want to welcome you back out to Dental Arts. We are back, one of their 5 locations, and I am so excited to finally meet Dr. Sorrell. I've been hearing a lot about you from Natalie. So happy that you guys are a part of our team and we get to talk dental health, which is so important. I've also heard a lot about your passion and why you're doing what you're doing. We're going to get into that in just a little bit. But first, dental health. Let's talk about prevention, because I think certainly over the last year and a half, 2 years, maybe some people have been putting off going to the dentist. Talk about prevention and why you kind of wanted to pick up that important topic again this morning.
Sure. Well, like I said last time with Natalie, is the cheapest dentistry you'll ever receive is the dentistry you never get. So prevention is actually the key. Many people are afraid to step foot in a dental office, and I do understand why, and I think that's why I'm a little bit more compassionate, as well as my partners are a little bit more compassionate, is that we actually understand that there is a person underneath us and they do have emotions and feelings. So if you've been not at the dental practice for the last year or two, prevention really is the key. And the reason for that is that your oral health is intimately linked to your systemic health or your full body health. With that being said, some of the really impressive links is heart disease. You're 3 times more likely to die from heart disease. You're 2 times more likely to die from stroke. It's linked to Alzheimer's or dementia. It's linked to erectile dysfunction. It's linked to preterm or low-term birth weight babies for pregnant women. Kidney issues, pancreatic cancers, oral cancers, all sorts of things.
Yeah, I can see why you really want to say, hey, listen, prevention is the idea. Also, bacteria. Talk about this, because what I was learning from you too, I mean, that can really lead to a lot of different things if it's, not treated.
Yes. So we've been desensitized in the field of dentistry to say it's just a cavity or it's just gum disease. But what it really is a bacterial infection in the mouth. You would never leave an untreated bacterial infection in your body. This is part of your body, right?
Yeah.
So with that being said, the bacteria, when you're at just gingivitis or the tip of gum disease, it's anaerobic or oxygen breathing bacteria. As it gets deeper into the gum tissue or deeper into the tooth, you have anaerobic, meaning that it doesn't breathe oxygen. And those are the angry bugs that cause bone destruction and it causes the inflammatory or cortisol releases and the issues with the systemic issues.
I was just going to say, now it makes sense. I think, wow, there's so many other health issues that can come up if this goes unchecked.
Yes.
You mentioned about getting people into the office. How important is it that, twice a year? How often should we? I think people get scared about the cost as well, right? But that's a passion of yours too, making it affordable for people.
Yes. So you have 2 points. When you're healthy and you've actually kept up with that prevention, right? Life hasn't gotten in the way, and don't be stressed if life got in the way, or obviously this huge pandemic. We understand that, and we're going to be able to correct things, right? And then we put you on a prevention from there. With that being said, if you are healthy, it's 2 times a year is recommended, right? If you're not healthy, you already have a disease progression and or the likelihood of disease to come about. So someone with heart disease, MDs are actually sending them to our office with a prescription for 4 times a year for cleanings, because MDs and physicians actually know that this is a systemic issue. For people with diabetes, you actually have a 400 to 700 times more likely premature death. With diabetes, you cannot control your insulin as well. So now all of a sudden diabetes is an issue, the onset or the lack of control of diabetes. You also should go 4 times a year and be checked out by the dentist 4 times a year. You also have a healing issue. So if something were to arise, we want to be able to control that better. Pregnant women, prior to getting pregnant, if you can plan it, you should come, and because you can only be treated in certain parts of your pregnancy. And then from there, you should have every 3 months, you should go to the dentist to get a cleaning, because you are more likely to have a premature or low birth weight baby if you have the gum bugs or bacteria. Anyone that has cancers and that are going to go on to chemotherapy or radiation should come to the dentist prior to too, to ensure that they are looked at.
Yeah.
And then from there, obviously, we work hand in hand with medical professionals.
Well, again, if you can't tell her passion by now, I don't know what else it's going to be. But let's end with your passion and kind of why you do what you do
Yes.
before we get to the special offer here this morning, because that really is kind of your heart.
Yes. With that being said, I honestly, I believe in prevention, and I want to touch more of the community. And as I was telling Natalie, I was in the service, and that's one of the things I learned is strength in numbers. So we grew with like-minded partners who are also as passionate as I am. And we have 5 locations. We want to touch more of the community. We built a wellness program so that people have the affordability to go and do those preventative measures. And I don't know.
Yeah, that's
would
it.
love to see everybody.
Again, if you can't tell the passion by now, I know, I don't know what will. But let's end. Just a couple seconds left. You have a great offer. You really want to get people in a great consultation offer, right?
Yes. So we have 2 different offers. There's a promotion for a person to step foot, get over that fear, or push through life stress.
Do it today. Yes.
And that's $99, and that takes care of your cleaning, your comprehensive exam, the treatment plan if you need anything, and any x-rays that you may need. Then we have a preventative option after that for you to come on and be part of our healthcare team and work with us, which is as low as $30 a month to take care of all your preventative needs for up to a year, your emergency visits,
wow. Okay.
and discounts on treatment if it arises.
Well, thank you so much we know how busy you are. Again, there's 5 offices here in the Bay Area, so we really appreciate your time this morning. Let us coming out to once again to Dental Arts. If you have any other questions, head to our website too. That's going to be a great place where you can get all that info as well.